We have a 46-year-old male with type 2 diabetes, A1C of 6.6%, develops a liver abscess that requires a long-standing drain. He is on cefpodoxime and metronidazole. Which of the following is a dose-dependent effect of metronidazole? Disulfiram-like reaction, peripheral neuropathy, urine discoloration, or metallic taste? So I'll give you about 10 seconds to think about it. The answer is peripheral neuropathy. So let's go and review actually all of these different side effects very briefly. So this is an obligatory molecular structure. I apologize. Should have put a trigger warning. Remember that metronidazole, also known as Flagyl, is an antibiotic and antiprotozoal. So for general coverage, we think of anaerobes, BV, trichomoniasis, giardiasis, and C. diff. It's falling out of favor in C. diff, but that's a talk for another time. Kind of reviewing the four main side effects that I had mentioned. We're going to go over disulfiram-like reaction, metallic taste, urine discoloration, and peripheral neuropathy. So as we all know, alcohol use, if you use alcohol, you get disulfiram actually inhibits aldehyde dehydrogenase. So you get an elevated acetaldehyde concentration, so you feel bad. Interestingly, metronidazole doesn't actually inhibit ALDH, so we have no idea why this happens. So I thought that was rather interesting. What I will say is you should avoid alcoholic beverages and products containing propylene glycol for at least 3 days after completion of metronidazole. So the next time your patient asks, when can I drink after finishing this? Say, please wait 3 days. Next up, we have the metallic taste. Hope you like the blue tongue. So the incidence rate is actually important here because it deters patients from completing their antibiotic regimen. So I found this really cool systematic review and meta-analysis that came out. And we don't really use tinidazole here, but it has a higher incidence of metallic taste. So metronidazole has a higher chance of adherence. So if you were ever having to pick between the two for whatever reason, please pick metronidazole. The urine discoloration is from the metabolite of metronidazole. All it does is darken the urine. There is actually no effect. But anytime someone has a change in urine color, you should do a thorough investigation. Finally, we have this peripheral neuropathy. So you notice how after about 4 to 6 weeks, we start to shy away from metronidazole. So this is why we do that. No one really knows why this happens or the overall incidence. It seems to be associated with if you take more than 42 grams of total of the drug or greater than 4 weeks of treatment. And symptoms actually resolve after you stop it. So this is something to monitor in your patients, especially the ones like the one in our vignette who was on metronidazole for a while. So in summary, check out the cool new logo at the bottom left from Dr. Wu. The disulfiram-like reaction can occur. We don't know why. Please tell your patients not to drink at least 3 days after completion of the course. For that metallic taste, this can affect medication adherence, so you should warn your patients about the potential for that. It can discolor your urine, but it has no adverse clinical effects. And finally, if you give it for an extended period of time, you can get peripheral neuropathy. What questions do you all have? Okay, there's a bonus slide today, just so you all are aware. I went a little bit crazy. So we have our Fast Facts archive on Google Drive. We have a feedback. So if you want to suggest a Fast Facts that you want us to do, please let us know. We're looking for new ideas. And then a big shout out to Dr. Jack Sharp for manning the sort of IT side of things all year. Now you're all in trouble because I am taking over. So I have now put in the video archive and I have sort of categorized it. It's all on YouTube. So you can access it on your phone very easily. It's bit.ly/IamFastFacts video archive.